Blepharoplasty, or eyelid rejuvenation surgery, is a surgical procedure that we perform to help eyelids look less tired, more youthful, to have more definition, to be tighter, and just to look fresher. Blepharoplasty can be performed on both the upper eyelids and the lower eyelids. One of the important pieces of information to keep in mind is that the upper eyelids and the eyebrows are closely related. So if the eyebrow is low, even though you think you might just need blepharoplasty, you may actually need a brow lift as well. And if your upper eyelid is droopy, you may need to tighten the muscle in the eyelid. So eyelid rejuvenation surgery can involve blepharoplasty in conjunction with brow lifting, ptosis repair, or other procedures. Almost anyone can be a candidate for blepharoplasty eyelid surgery if they are unhappy with the appearance of their eyelids. Now, there are certain degrees of limitation that we have when doing surgery. If the differences between the eyes are extraordinarily minute, it can be difficult to make them exactly perfect. But the vast majority of people who we see who either have asymmetry of the eyes or just don't like the way their eyelids look are good candidates for blepharoplasty surgery. Blepharoplasty surgery is really very easy for most patients to tolerate. It's usually a really good experience. One of the most important things that we ask our patients to do before blepharoplasty is to hold off aspirin, Motrin, Advil, ibuprofen, or any blood thinning products. And those can even include some vitamins, some supplements, some things that you don't really think about traditionally as blood thinners. We'll give you a whole list of what those products look like. But aside from that, take good care of yourself, get plenty of rest, try to avoid alcohol for about 24 to 48 hours before surgery, and come in ready to go. The day of blepharoplasty surgery, people typically are a little bit nervous, and that's actually normal. If you're not nervous the day of surgery, that makes me a little bit nervous. Usually the scenario works well. You'll come either to the outpatient surgery center where we do many of the procedures, or into the office where we do some as well. And we'll get you comfortable, make sure all the paperwork is taken care of and so forth. And then I'll begin to draw some lines on the eyelids indicating what I want to do surgically, where I want to make my incisions and so forth. Gives us an opportunity to talk one more time about what we're going to do. You can ask any questions that you might have. Once we're all ready to go, we'll make sure that you're comfortable and take you on back to the operator. Recovery after blepharoplasty surgery is really very well tolerated by almost all patients. Probably 90% or more of our patients take only extra strength Tylenol for pain relief. There's always going to be bruising and swelling after surgery. So the better you can be about using cold compresses on your eyelids, the better you tend to do in terms of the amount of swelling and bruising that develops. We have one patient who had almost no bruising or swelling just 3 or 4 days after surgery, and we asked what was the secret, and he said ice and Netflix. He used ice and watched Netflix and was very diligent. You want to make sure you don't put a frozen ice cube on your skin. Always have a cold cloth or something, but the more diligent you can be with ice, taking it easy, try not to do much in the way of heavy exertion or busy activities, you should do really